What's up, you guys? It's your boy Miguel, giving you your daily dose of radiation. In today's video, we'll cover what it's like to be a night tech, X-ray tech. To give you context, I work at a ER, Trauma 3. There is two of us, so anywhere you work at nighttime, usually the staff in any department gets cut down pretty much almost in half. I would say is a good gist. Gets cut down in half. And then, depending on if you're like we have two emergencies department here. We have the main one where I work at, and then we have the small tiny one over there. CT does both X-ray and CAT scan because there's not as many, so it's just one tech holding it down. Over here we have two X-rays and one CT, and then I think one ultrasound, and then MRI gets called in as needed, and then nuke med. They never really, maybe one time have I seen them in my whole career. So usually how it goes, you'll come in. Some places start at 7, some at 8, some at 9. We have one that starts like over here like at 10 p.m. And usually you'll come in, day shift. It's like, yo, you got this left over, go shoot it, whatever, get situated. Usually in the morning, depending, in the afternoon, as you begin your shift, between like 8 to 12 is kind of your busiest kind of amount of workflow. And then after 12:30 or 1, depending on when your morning ports spawn in, if you work at a hospital, you'll have morning ports. It's basically almost, majority of it is chest x-rays that they want the doctors to shoot them before they get here at 6 to 5 a.m. depending on when they get here. So basically between 12:30 to 5 a.m. or 6 is your window to shoot everything. So you kind of make your rounds whenever you're free from the emergency department. And then usually depending how many come in, it can vary between 10 all the way to 30. So depending on that, we'll kind of split up, the workload. And it's almost like if you can manage to knock out all your morning portables and you can just come to the ER, the faster you can do that, most of the time you can chill pretty good. Because that's like the one thing, we call it the random variable that will determine how the rest of your shift goes. Like if you get a small morning port list, you can either go ahead and knock it out, or you can wait and push it back and hope they put more add-ons or whatever they got to do. And then you have as soon as they come in, you split it half of because usually there's 2 towers, well, I don't know, depending on where you work, but ours is 2 different towers. You'll go and shoot some at one time, and you go shoot some at the other time, kind of split it up. Or there's other techs that both go separately and divide and conquer. But it all depends on you and your peep. Something to keep in mind, to be the most optimal, if you pay attention when certain departments or floors make their rounds. If you know a certain floor is going to make the round at 2 a.m., don't go at 2. You know why? Because the nurses and the doctors will be in the room, and it will kind of set you back. So or even you can even ask, you're like, hey, what time do y'all make your rounds? They'll tell you, oh, this and this and that. So we've kind of optimized it. Obviously, you might get called into the floor early because someone's coding or something. You might have to go to the floor early, and then you're like, well, I'm already up here. Let me go shoot some ports, But on a dream occasion, you'll have I'll go to the floor at a certain time, knock it out. There's just quick and easy, come back down. And yeah, that's the main part. Occasionally you'll have people coding and rapid response. But for the most part, you'll be chilling in the ER, holding down whatever comes in. And then you have the morning add-ons around 7. Residents and the other doctors come in to see what they forgot to order, or if there was patients who came in overnight that ended up needing to get some exams and stuff done, or they forgot, or that ends your work list, like scheduled thing. That too. That's another thing you look into, which will kind of be made responsible. And then depending on your hospital and all the stuff, there's maybe a cutoff to where, okay, at a certain time, you don't have to go back up to the floor and shoot stuff. Ours is 7 o'clock. Any exam that ordered non-stat after 7, like if we're slammed in the ER, we really don't have to go. So that's how that goes. And then once again, day shift comes in. You'll give them the little briefing. Okay, this portable's down, or we weren't able to do this, or hey, so-and-so called, they were wondering about this. And then after that, it's really about it. Now, I'm going to give you context. This will kind of depending on, just to give you a general number. So I've counted, based off of the gloves I use, I go through 2 boxes of gloves in my 7. Each one has 250 pairs. So I've calculated it that, because I'm the only one who uses extra large in my department, so 250 divided by 2 boxes is equivalent to about 250 patients / exams, I guess. Patients that I do on an average 7 at a trauma 3. Which I did the math, it comes out to about like $7 a picture. Like an exam. Not a picture, but $7 a picture. So it's just kind of random. Just throwing that out there. And yeah, it's been your boy Miguel. Hope you enjoyed this video and get some knowledge out of this. I will continue making these niche contexts to those who are curious. And yeah, it's been your boy Miguel. See ya on the next one.